living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
It's flu season again, and we're still in the thick of a COVID-19 pandemic. Last year, we managed to avoid a surge of influenza cases, but now there's concern that we may be having what healthcare experts call a twindemic. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we're going to be talking about the flu vaccine, and what the next couple of months might look like in the thick of COVID. Stay with us. Welcome back to Healthy Living for Life. Joining us this morning are two of Mountain Pacific Quality Health's very own, Dr. Douglas Kunstweiler, who is our Chief Medical Officer, and Pharmacy Manager Tony King. And thanks so much for joining us today, gentlemen.
Glad to be here.
Okay, Dr. Kunstweiler, I'm going to start with you. Let's talk about last year's flu season and how that went. Do we know number of cases? What were the numbers like for last year's flu season?
They were astounding. I'm not aware of a single case of influenza in Montana, which is unheard of. Nationwide, CDC reported about 1,600 positive cases through the whole flu season for the entire country. And that's a couple of % of what a normal flu year looks like. So very, very low numbers.
And do we know why those numbers were so low?
Well, we think that all of the measures that were taken against COVID probably helped to prevent influenza. People were not traveling very much. Schools were being conducted at home by and large. We weren't having big gatherings of people. People were wearing masks. They were using good hand hygiene. They were socially distancing. And we think that all of those things led to a very, very low influenza season.
Are there any predictions about what this year's flu season might be like?
Yes, anything that you would like has been predicted. It's either going to be disastrously high because people lost their immunity during this last season when influenza wasn't around, or it's going to be low again because of the measures people are taking. Nobody really knows. The experts disagree on this, and there just isn't good data to predict what's going to happen.
Okay, and let's talk about data a little bit. Maybe I'll direct this one to you, Tony. So my understanding is, and correct me if I'm wrong, that what we do is we use last year's flu strains to figure out how to create this year's flu vaccine. And since we had low numbers, what does that mean for vaccine development?
Well, and that's not quite correct.
Okay.
Usually what they do is they look at the countries in the southern hemisphere. That's generally where the influenza strains start. So we get kind of a head start by monitoring what's going on in China and Australia and other countries in the southern hemisphere. The problem with predictions right now is those countries are right now in severe COVID lockdown, so they're not showing the influenza cases that we would normally track. That may or may not be good. A lot of times if there's limited travel, people aren't traveling from country to country, bringing it back to the States. That's generally how it proliferates or gets spread in the United States. We're not seeing a lot of cases in the southern hemisphere right now. The other good part about last year's flu season is it didn't go throughout the country and mutate. So it genetically is very similar to in years past from what they're showing. So we do have a template. We do follow that when we're building the vaccine. So right now, from the way it looks, the vaccine will be effective.
Okay, great. And my understanding is that this year's vaccine, and I should have asked you how to pronounce this before we got started, but is it a quadrivalent? Quadrivalent flu vaccine. Yep. And so what does that mean?
It means it has 4 strains in it. They used to have a trivalent, so that it had 3 strains. It had 2 strains of influenza A and 2 strains of influenza B. About the time of some of the other strains of flu that came through, they found that they could add more into it. So really there's 4 different strains. They try and find and isolate the 4 most common strains when they're studying those flu cases, and then build the vaccine to protect for those. It just adds into the efficacy of it.
And that was going to be my question. That will help make it more effective.
Hopefully, it should.
Okay, great. And here's a question that we ask every year, but it's good to remind who should get the flu vaccine.
Pretty much cradle to grave, 6 months old to anybody, the elderly, those in nursing homes, so pretty much everybody. The only exceptions are those who have had severe allergies or allergic reactions to the vaccine in the past.
Okay, and what months are flu vaccines typically available, and where can people go to get them?
Well, they're available right now. We usually recommend that people start getting vaccinated at least by October, but the pharmacies, clinics, urgent cares, public health agencies, they should all have the vaccine now.
Okay, great. And is it just a shot, or can people get the nasal spray this year?
The nasal spray is a live vaccine, so it's pretty limited in its use. Some people that are really afraid of getting an injection with a needle prefer to have it, but you really need to not have any other health conditions. You can't be immunocompromised. You have to be a pretty healthy adult to get it. So it's not as common. It is out there. You just probably need to call around to make sure that they have it, or they can order it for you.
Okay.
It's not recommended in pregnant women either because it is a live virus.
Okay, that's good to know. So we're going to talk after the break a little bit about how flu and COVID and how those two are going to mix together. But before we take this first break, any final thoughts about specifically the flu and the flu vaccine?
Well, I would say don't let your guard down. The fact that we had a really mild year last year doesn't mean it'll be the same this year. So go get your flu vaccine.
Okay, great. Anything you would add there, Tony?
It's available. I got mine. I know Dr. K got his already. The pharmacies have it. I know the health clinics in and around town are providing it now too. So there's really, don't wait for the snow to fly.
Yeah,
Let's get it done.
That is good advice. And I already got mine too, so we're all vaccinated together. Okay, we are going to pause here for a quick break, but when we come back, we are going to talk about flu and COVID-19 and how that's all going to mingle together during this flu season and what that looks like and what you should know when it comes to the COVID vaccine and boosters and what you should do if you're feeling sick. Stay with us. We'll be right back after these messages. Welcome back. We're still talking with Dr. Douglas Kunstweiler and pharmacist Tony King, and now we're going to talk about how flu and COVID are going to mix together more this year than they did last year. And let's start with the COVID vaccine. Do we think that the COVID vaccine is going to be like the influenza vaccine where we're likely going to have to get it every year?
I don't think we have enough information to know that yet. The way that influenza changes is somewhat unique in the viral field. And it's true that COVID has morphed and has several different variants, but so far the vaccines that have been developed seem to be covering the variants. So right now it's possible that we will need a yearly shot, but it's just too soon to say.
Okay, fair enough. And if a person gets sick, is it possible they could have the flu and COVID at the same time?
You could be unfortunate enough to get both at the same time. There's no reason why you couldn't.
And then what about vaccines? Should people get the flu and the COVID vaccine? Or if they're ready for a COVID booster, is that safe to get at the same time?
Yeah, it's absolutely safe to get both the influenza vaccine and the COVID vaccine, whether you're initial series or a booster, but you can get them both at the same time.
Okay, great. So, as always, the rumors are starting to fly about things, and as we get into the flu season, the rumor I just heard is that the COVID vaccine, or the flu vaccine, increases your chance of getting COVID. Can you speak to that a little bit?
Yeah, you bet. So there are misinterpretations of data where people come up with a wrong conclusion. It's okay to be wrong. Data can be looked at again and you can be corrected. But then there's also telling lies, and this is a lie. There is absolutely no data that would show that any vaccine enhances your chance of getting COVID. It's simply a lie. It's been propagated on the internet, I know, but there's no truth to it.
Okay. Let's talk about another one that's kind of out there, because people know COVID is a virus, flu is a virus. If you get one shot or the other, does it help at all to protect you from either virus?
I've read some data that if you get the influenza vaccine, it probably does help a little bit in prevention of COVID. And we think that it sort of wakes up your immune system, gets it revved up, and so it's sort of on hyper alert status, and it does seem to offer a little bit of protection. But I would not rely on that. I would go ahead and get the COVID vaccine as well.
Okay. So we talked about variants and that the COVID vaccine does seem to be covering those variants pretty well. As we get into the flu season, are there other variants that people are keeping an eye out for? Obviously, the Delta variant is a big one, and we've been talking about that, but are there any we're keeping an eye on that might come out during the flu season and be an issue?
Yes, there are some others. There's one that's come from South America, the Mu variant, although I don't know, Tony, I haven't heard much about any of these others lately. Delta seems to still be predominating.
Yeah, we did one of these a couple weeks ago, and the Mu was newly introduced, but they really haven't had any traction on it. But everything that they're showing at this time shows that the current vaccine is working on all the variants. There's nothing out there that shows that there's a breakthrough variant at this time.
And you said Mu.
Mu.
Mu, okay, gotcha.
Greek
And
letter
we're
mu.
going through the Greek alphabet with these, is that what we do? Okay, that's good to know. So we're
It's
pretty
kind of like
deep.
hurricanes.
Yeah, right. We're deep into that alphabet, unfortunately. So when we think about the healthcare system dealing with the flu season and these COVID cases, what are we doing to our healthcare system right now?
Well, we're pretty much wrecking it right now. I talked to some of my colleagues at St. Peter's last week, and even relatively small hospitals like St. Peter's are being overwhelmed. They're accepting transfers from Seattle. They're having to transfer patients as far as Portland. Everybody across the country is experiencing a lack of beds, and even more importantly, a lack of staff to take care of patients. It pretty much has overwhelmed all of our healthcare systems.
And so to help with that, obviously, we're trying to get folks to get vaccinated. Let's talk about the booster. When should people get the booster, and is that a different shot than the original vaccine, and will that help people stay out of the hospital?
That sounds like a pharmacist question.
Sure. The only booster right now that's approved is the Pfizer one. They have submitted data from other studies to get the Moderna booster, and Johnson & Johnson just yesterday or today put in a request to have a booster approved for theirs as well. The panel's going to review that data on October 15th, and hopefully we'll have an announcement shortly thereafter of which way they're going to go. There is a differentiation between the booster and a third shot. Some people need a third shot. If they're immunocompromised, if they didn't get enough immune response on the first two shots, their provider may recommend they get a third shot. Okay. Right now, for the Pfizer vaccine, that's the exact same shot. It's not a different strength, it's not a different quantity, it's the same thing. So what we recommend is talking to the healthcare provider, letting them know you're interested in the booster, get their thoughts and feelings on that. Really, if you're 6 months past your second shot, you may be due for either a third shot or the booster at this time.
Okay, and for those folks who are concerned about side effects, either with the flu vaccine or the COVID vaccine, can you provide some advice there, Tony?
Yeah, right now, all the studies are showing that the side effects from that booster or third shot are exactly the same as the second shot. So if you've gotten the first two, you should know kind of what to expect when you get that third shot. The flu shot, really, some people say it wipes them out for a day or two. That's just your immune system building up. It's more sore arm, injection site reaction to that. There really isn't for the killed flu vaccine. There really isn't side effects to it that you should experience. If you have anaphylactic reaction, if you're starting seeing streaks or your arm, your throat closes, things like that, that's a different type of reaction. So you really need to contact a healthcare provider, get to the ER for that. But overall side effects for flu shot, very minimal.
Okay. Great. All right, we're up against another commercial break here, so we do need to pause here for a couple minutes. But when we come back, if you're experiencing symptoms or just not feeling very well, what should you do? With flu and COVID out there, you might not know what's going on. We've got some advice for you right after this. Stay with us. Welcome back. We're talking about this coming flu season. Well, actually, we're in the flu season and what it looks like with COVID in the mix. And I'm going to start with you again, Dr. Kunzweiler. This term Twindemic that's getting bounced around now. Have you heard of that term? What does that mean?
Yeah, people started mentioning that, I think, about a year ago. And at the start of flu season, they were concerned because COVID was pretty rampant at that time, and they were afraid that if we also had a large epidemic of influenza, that the two together would overwhelm the healthcare system. And so somebody coined the term twindemic, meaning an epidemic of both influenza and COVID.
And we certainly want to try to avoid that because, as we mentioned before, the hospitals are getting overwhelmed. Do you think there's going to be a tipping point where people just aren't going to be able to get care if they're sick?
Oh, we've already hit that. There are people who have been turned away from hospitals because they have no more ICU beds, they have no more staff, and people are having to be transferred, to places where there is an open bed and there are staff. We've already hit that, and it's pretty much nationwide. It's all over.
Wow, so let's talk about if people are not feeling well. First, let's back up a little bit, and if someone is feeling sick and they're having symptoms, will they be able to tell, oh, this is more like flu symptoms, this is more like COVID symptoms? Are they the same, different?
No, they're very similar. I mean, headache, fever, cough, runny nose, maybe shortness of breath. You can see the same with influenza and with COVID. And it is important that people get tested so that we know what's going on. So they shouldn't be discouraged from getting tested. What I would recommend is that they call their provider, or if they don't have one, call an urgent care and let them know what your symptoms are, and they'll give you advice about where to go to get tested.
I know a lot of people have talked about how the two spread and whether flu spreads faster than COVID. Do they spread the same way, and do they spread in the same rates?
Well, they're both respiratory viruses, so they're spread through cough, sneeze, and even just talking. Actually, COVID is a little more transmissible. It spreads a little more easily than influenza does by a factor of about 3. So that's part of why COVID has been so devastating. It's very easy to transmit.
So to help ourselves and the healthcare systems, vaccines are definitely something that we're talking about, but what are some other preventative steps folks can take?
Well, as we thought we were coming out of COVID, people seem to have relaxed. They weren't socially distancing. They were gathering in large gatherings again, trying to enjoy the summer, trying to get back to normal. But really all the precautions that we took last year for COVID, we really should be doing those again now. Socially distance, masking, good hand hygiene. Don't try to gather in crowds. Try to keep your distance. If you're sick, stay home. People understand at this point that we don't want to spread this around. So really, if we could go back and re-implement a lot of the things we did a year ago, it would really help not only the healthcare systems, schools, but pretty much the communities.
So if someone is feeling sick to the point where they need help, what's the protocol now? Do they go to the ER? Do they make a phone call? I know for even getting tested, they were talking about call first for COVID. Is that still in place? Can you give folks advice? What do they do? Yeah,
I think that should still be in place. Now, the caveat I would throw in is if you're really having a lot of trouble, if you're really short of breath or you're feeling dizzy or like you might pass out, then I think going to the emergency department is the correct thing to do. But if you're not having emergent symptoms like that, then I think I would try to call ahead and get instructions on where to go to get tested. Because a lot of clinics might want to test you in the parking lot rather than bring you inside where you might contaminate other people. So you really should call ahead and give them a heads up, and they can give you the best advice.
And so let's talk about those tests a little bit. If you go there, is there a test that you can do for both COVID and flu? Are there 2 tests? What will that look like?
Well, they're separate tests, so you might get swabbed twice. There is a swab that includes a variety of respiratory illnesses, but I think the most likely scenario is that you would get swabbed both for influenza and for COVID, so you're going to get stuck in the nose twice.
Okay. So let's talk about complications, because that's a big part for folks who are getting sick with either flu or COVID. It's the complications that come about that can be really troublesome. Are the complications the same for flu and COVID?
I would say generally not. COVID seems to attack more organ systems than influenza does. The big one, of course, is pneumonia, and you can certainly get pneumonia from influenza, and that can be fatal. With COVID, it's quite common to get pneumonia, but also COVID seems to attack other organs. It attacks the GI system, it can attack the heart, it can attack the brain. So COVID of the two is a much worse actor.
Okay, and I'm glad you brought up pneumococcal and pneumonia, and so Tony, let's talk about vaccines again there, because people might be due for their pneumococcal. When does somebody get their pneumococcal vaccine, and should they have any concerns about getting the flu and the COVID and pneumococcal all together?
Well, there's a number of pneumococcal vaccines, so it kind of also depends on when you got your last one and what some of your other health conditions are. If you have respiratory illness, if you're a smoker, asthmatic, things like that, generally you get a pneumococcal shot every 5 years. Once you start getting up there in age, they recommend a pneumococcal 55, 65, depending on which healthcare provider you talk to. But if you're already prone to some of those, you get it pretty frequently. As far as getting it in conjunction with your COVID and flu shot, that's just fine. Just talk to your healthcare provider first, make sure they're on board, make sure that they're comfortable with that. But you can get all of them at the same time if you need to.
Okay, awesome, gentlemen. We're almost out of time. Final thoughts?
Get vaccinated, wear your mask, wash your hands. If you're sick, stay home.
Okay, Tony?
Thank your healthcare provider. You know, they're facing some extreme odds. They're burning out at record numbers. They're trying to do what they can, but if we're not doing what we can, it's frustrating on their end. So if you have a chance, just say thank you.
That's really nice, Tony. Thank you. And then do our part to protect ourselves and other people.
Absolutely.
Keep banging that get vaccinated drum. Thank you so much for being here. Appreciate it. And thank you so much for watching. We hope you'll come back and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a wonderful week. We'll see you next weekend.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org. or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.